helped, but it actually made people's acne worse.
Right, because to the eye, it looks like it's receding, but yet if you had the x-ray of what's actually under the skin, you know, with the root, you'd see it probably maybe even growing.
Yeah, and actually, then superficially, they will have more eruptions on the surface as well.
I know that you guys, both doctors, and you both work at Advanced Dermatology. Now, how is it that you treat this acne then when a client comes in or a patient comes in to your clinic?
Well, we have a myriad of options that we treat complexions with, depending on first what type of complexion, the severity, how aggressive a patient wants to be.
Okay.
Some people may have very few blemishes but want to be quite aggressive, and some people have rather dramatic blemishes but aren't that interested in being aggressive. Because the more aggressive you are, the more medications, the more you have to remember to use them, the more potential for side effects, irritation, or if you're taking something internally, but certainly the more potential benefit to try to correct the problems. And so it ranges anywhere from medications that are topical, antibiotic washes, to topical antibiotics, to medications that peel off the top layer of skin and roof, the blemishes that are deeper, to antibiotics that are taken internally, or for some women, talking about hormonal control, blocking that testosterone that aggravates the complexion, as we talked about earlier. And then the most aggressive treatment is the Accutane that we can use. Accutane is a medication that's a synthetic vitamin A that makes the skin slough to a greater degree, helps dry up, shrink the oil glands, and so there's some long-term benefit from a medication like that. There's also some more potential risks with that, which is the reason that we try other medications first to make sure that those easy routine sort of options don't work for a person, that you need to do something more aggressive.
Sure.
As Dr. OJ mentioned, we have the full range of all medical treatments available to us. Not all clinics actually offer Accutane. We're an iPledge clinic because it's a lot more work. It's a very invasive, excuse me, not invasive, very intensive kind of therapy. But we really think it's to our patients' advantage to have all the options available to treat acne. We really do try to make sure that we're using medicines that have the least side effects, and we take, above all, do no harm very seriously, because again, 20 years ago we just used to have oral antibiotics, and that was the mainstay that we would do for treatments.
Yes.
Now, I'm not saying we never use oral antibiotics, because we do, but now with antibiotic resistance being a problem and a lot more topical treatments available, we don't have to go to that as much.
Okay.
Although Dr. OJ did mention oral antibiotics, birth control pills, spironolactone, you know, there are other oral medications that we use, as well as Accutane. There are a lot more topicals. There's medicated washes, there's topical antibiotics. I really like using that, because then you don't get the side effect of, when you take an antibiotic, of course you get the side effect, goes to every cell in your body.
Exactly.
If you're using a topical medicine, it just goes where you put it. And
But
so
you're
that's
giving
kind of
people a choice. And
Yeah.
you know, you educate them on, you know,
Yeah.
all the options, and how long, of course, then it would see visual results,
Right.
you know, depending on what product they chose to do. And some people have a little more sensitive stomach, you know, on that line, and so you don't want to go that way, but you want to basically work what will fit into their lifestyle too,
Right.
to complement them.
Yeah, and some people are good at using medicines topical medicines twice a day, and some people have a harder time with that. And luckily, in the last few years, there's been some medicines that come out that's just once a day.
Oh.
That's nice. It's easier for a teen, or, well, even people like us to remember to do something once a day than twice a day.
Yeah, exactly.
So it's nice to have those options. They're easier to use, and they're more effective. I think our treatment gets more and more advanced with the things that we have to offer. Those are medical treatments, and those are usually covered by insurance, but we also, at Advanced Dermatology Care, we also have other treatments that aren't covered by insurance. They're considered medically unnecessary, but they're really very helpful adjuncts. They're chemical peels, microdermabrasions, photodynamic therapy. We have a Cool Touch laser that can help shrink the cysts, and those are really very nice and very beneficial to have as well.
You know, you see a few people, older people, that actually have the pox on their skin, you know, from that. I mean, do you really put a price on that? You know? And
Yeah.
That's the whole problem. We
Right.
really need to, because we are such a how people look society, you know, and they had that problem when they were younger. And now it's nice to know that, you know, we don't have to live that way.
Right.
And that you don't have to have your child have the acne scars.
Yeah.
You know.
It is nice to, first of all, try to prevent those. And secondly, now we have lasers, and we have cool touch laser and microdermabrasion. We have dermasweep dermabrasion, as well as our Fraxel CO2 ablative laser that can treat those deep acne scars. And it's really wonderful to see those results.
Yeah, that's so great.
Yeah, people's self-esteem really improve quite a bit when you can get rid of something like that. It's really nice.
We talked a little bit about acne, but then there's, for the adults that have problems, the rosacea. Some of the products that we use for kids, the topical washes, the topical retinoids, can be also of some benefit for adults. But adults seem to have, the rosacea has a little bit more intimate relationship to food and diet. And that can vary from person to person. There's just lists of all the different things that can make a person break out, you know, ranging from food, such as liver, to beverages, such as red wine, to the temperature of the food, to the spicy nature of the food. And so not only things that are ingested, but also even environmental factors, sun, wind, all those sorts of things that don't have the same effect as it does when a person is younger. And certainly stress is also a universal factor there, or can be. And then also some of the treatments that Dr. Ruth was mentioning was the laser treatments that can be helpful for the redness, to help get rid of that so the flushing isn't quite as dramatic. So those can be quite helpful in addition.
Yeah, we have a skin rejuvenation laser. It's an IPL laser that's just wonderful for rosacea. It's been studied many, many times, and I think it's been studied enough that insurance should cover the cost of it, but they haven't yet done that. But some people with rosacea, which is a specialized form of acne, it used to be called adult onset acne. But anyway, some people with rosacea actually have burning, and their skin is dry and tight and burning, and the skin rejuvenation laser that we have at Advanced Dermatology Care really helps not only decrease those superficial blood vessels, but actually makes their skin comfortable and decreases those side effects. So it's really, really nice.
Yeah, you want to get that resolved.
And then there's also the social stigmata of redness in the face and the concern about alcohol and alcohol abuse that can be related. And some people that have rosacea don't drink alcohol at all, and they feel self-conscious about that. And so the
people
laser can be
judge them.
Yeah, they feel like they look like W.C. Fields, that whole stereotype. And it's a hard thing to live down, you know.
Exactly.
So, and it's not the cause.
Yeah, with the nose. And I was just wondering if we could get back to the actual acne, because I know that my mother, when I was breaking out, just loved to have me in her lap, and she just wanted to get that little
to squeeze them.
She wanted to get that out, because she just said, oh, if we get the poison, you know, like that's what she called the actual pus inside. If I just squeeze them, they'll all go away, you know. And she tried so hard, and I was just wondering, is that a myth also, or should we go ahead and let the moms go at it?
It'd be better not.
Okay.
Do you want?
What I tell patients is you get one chance to squeeze a pimple.
Oh, okay.
So make it a good one.
Oh.
So if you have something that's rather superficial, take a warm washcloth, try to get it to the surface, and then you get one chance. But the problem is if you keep going after it, and not just the squeezing, but the gouging, the digging, the multiple repeating, it starts to heal, you go after it again. That constant trauma just doesn't allow it to heal, and you're more likely to get a scar that results, instead of, you know, the short-term benefit of trying to make it look less noticeable. You're going to get the long-term disfigurement.
Right. Well,
And it increases the chances of injecting more of the superficial bacteria in the skin into an open lesion as well.
oh, sure.
The skin barrier is inflamed and breached, and bacteria can easily get in. So.
I mean, the body is an amazing tool. You know, people are so aware of what their face, you know, that type of thing. So I guess that's a good rule of thumb to go by. Yeah, let it just naturally do that. What other treatments do you have at Advanced Dermatology to talk about either rosacea or acne?
I think a lot of it is